Principal Medical Laboratory Scientist, Senior Medical Laboratory Scientist, Medical Laboratory Scientist present, COPA, and my fellow intern. I count the great privilege to stand before us to do this seminar presentation. It's an opportunity for me to speak before my teachers and instructor. Out of all the things I've been taught during my internship here at histopathology, I'll be presenting on the topic identifying common artifacts and handling errors in histopathology. This is the next slide. The next slide. In this seminar presentation, I will give the introduction and I'll talk about some of the different artifacts and how to handle these errors in processing tissues, and then with the conclusion. The next slide. Artifacts are actually features that are not normally present in living tissues, but they are introduced into the tissue during the process of processing these tissues. These artifacts can mimic pathological changes, or sometimes they can even obscure through findings. And it is important to understand these artifacts, important to know them, and to be able to identify them so that it will help in accurate diagnosis. There are different classifications of artifacts due to the different stages of tissue processing. Because during this process, any error can introduce this artifact to the session. We have the pre-fixation or the surgical artifacts, example the crush and the suction induced. We have fixation artifacts. We have processing embedding artifacts. We have sectioning and microtomy artifacts. We have staining and mounting artifacts. We have microscopy interpretation artifacts. I will explain them one by one. The pre-fixation or surgical artifact is introduced due to the surgical process that is before fixation, depending on the technique used during surgery in removing that tissue. An error in that process can introduce artifact to the tissue section. For example, you have the forceps crush. Maybe during the handling of the tissue, if the forceps used, the surgeon applied too much pressure to it, it can crush the tissue, which will now bring about crush artifact when viewing the slide. You have the electrocautery heat. This one is introduced during surgery when heat is used. There's laser heat is used during the surgery, and then you have the local anesthetic injection artifact. The injection too can introduce artifact to the tissue. This artifact is important that we know them to help differentiate pathological destruction or hemorrhage. The next slide. So for the pre-fixation and surgical plates, these are some of the plates I have identified to help portray this artifact. The first one is the hemorrhage artifact. This one is not the pathological hemorrhage. This hemorrhage is just due to maybe the handling of the tissue before fixation. So you see it appearing as if it's the pathological hemorrhage, whereas it is not the real pathological hemorrhage. And then we also have the heat damage. Remember, during surgery, sometimes heat can be applied in destroying some tumor cells. So this process can introduce damage to some of the cells. You can see the arrow pointing. You can see some absence of some cell at that basement of the tissue. So that one is a heat damage artifact. Then the third plate shows us the tissue crush, showing the tearing and the void due to maybe the pressure applied in handling that tissue. The next slide. We have the fixation artifact. This one is introduced during fixation. It could be due to poor fixation, maybe because of the fixative use. It's not the standard fixative. Or it could also be maybe due to prolonged fixation. That is, instead of the normal timing for fixating the tissue, it now stays for a longer time. That can also introduce artifacts. And some of the artifacts you can find under this stage is the formalin pigment. You can have shrinkage and then the streaming. Let's go to the next slide so we'll see the plates. Here shows us the brown-black formalin pigment due to acid formaldehyde. If it is an acid formaldehyde that is used instead of the 10% neutral profile formalin, that will react with the blood and bring about this brown-black formalin pigment. It may now
That is an artifact that will represent as if it's a pathological condition, whereas it is not a pathological condition. The next slide. Then we move on to the processing and embedding artifacts. During the processing period of this tissue, the tissue undergoes dehydration, it undergoes clearing, infiltration, and embedding. Any error in any of this stage can also introduce artifacts. You can have folds, you can have holes, incomplete filtration, water artifacts, and paraffin. The next slide. This first plate, the plate 5, shows us the tissue folding artifact. You can see how the tissue is folded. Instead of coming out clearly, there is fold. This happens during sectioning, if it is not properly sectioned. Then you have holes and void due to incomplete paraffin infiltration. That is what the plate 6 is showing. You can see that void here because of the incomplete paraffin filtration. Then plate 7 is showing us tissue fold, and the next one is showing us air bubble during mounting, or even during the floating stage when you're picking the tissue section from the water bath. The next slide. You have the sectioning microtomy artifacts introduced during microtomy. You can have the cutter, you can have knife marks, compression, and then coiling. This can distort the real architecture of the tissue, and it will make diagnosis very difficult. The next slide. So here, this one shows the chatter vibration lines showing like ridges. So instead of bringing out the tissue plainly and very fine, you see the ridges because of the maybe dull blade that is used. Then the next one is the knife marks. You can see those sharp marks in the tissue. It's not any pathological condition. It's just due to that blade. Then the last one there, the plate 10, shows us some compression artifact, the tissue smearing. So towards the end of the tissue, you see there is a compression there due to some of the errors in microtomy. So in order to avoid this particular artifact, it's important that the blade that is used in microtomy should be sharp, and then the clearance angle where the blade is positioned to where the tissue is being kept should be in the correct clearance angle. The clearance angle used is between 3 degrees to 8 degrees. Some persons use 5 degrees. Then the block quality should be good to come out well. The next slide. Then during staining and also mounting, artifacts can be introduced if poor stains are used, and then if the mounting is not done properly. You can have the residual wax. If maybe the wax was not properly removed, you can see some of the wax in the section. Then stained precipitate, you can have air bubbles, you can have dust, and all of these things can mimic pathological conditions. The next slide. So here, plate 11 shows us an improper wax clearing resulting due to undue staining. The staining was not done properly. It could be maybe during the drying, the waxing, it was not done properly. So if the staining is done, it will not come out fine. You could see the improper wax clearing. The next one shows the air bubbles that is done during a mounting. If the mounting is not properly done, you will see those something like L form, that is an L bubble. Then the last one is stained precipitate aggregated on the section, maybe due to the poor stains that was used. Like if we're doing that hematoxylin, every morning we filter it. So peradventure that stain is not filtered, it can bring about some of these stained precipitate. So proper washing is important during staining to avoid some of this artifact, and then fresh reagent should be used. Clean mounting, and then during the cover sleeping, when you're cover sleeping, you try to avoid every possible error. The next one.
Proper dewaxing.
Proper dewaxing. Yes. Thank you very much. The next slide. So for cytological processing, because we also deal with cytological smears, artifacts too can be introduced when not done properly. Some of these artifacts include air drying, poor fixation, overlapping, dry artifacts, and then contamination. These artifacts also can mimic malignancy, such in the case of cytoplasmic vaccination or nuclear distortion. And these artifacts can also mask some of the features that you're supposed to see in the slide. The next slide. So these are some of the plates for cytological artifacts. Here, the plate 14 shows us air drying causing cytoplastic changes. Normally, cytological slide, immediately they are done, they are supposed to be introduced in a fixative. But between the process of introducing it to fixative, if that slide is allowed to dry before introducing to fixative, the staining will not come out well. And that's why it's important that all cytological slides should be introduced to fixative immediately so that the staining can come out well. Then the next slide shows us overlapping cells mimicking clustering. These are cells overlapping, either due to the fact that the person doing the smear did not spread it properly. So you notice that some of the cells will now overlap. It will now be looking as if it's a pathological condition, but it is not. The next slide. So this artifact can lead to misinterpretation. Artifacts mimic pathology and they hide pathology in some cases. So some of these artifacts, even if there is a pathological condition that tissue has, because of the introduction of that artifact, some of those pathological conditions may not be seen. Then it can also lead to false negative slide due to poor preparation. If these tissues were not properly processed, even though the tissue may have some true lesions, but because the tissue is not properly processed and prepared, it will not appear as if there is no lesion when viewing the slide because of this artifact. So that's why it is important the awareness of artifacts is made to help us distinguish true artifacts from true lesions. The next slide. So what are the quality control and how to handle this error in histopathology and cytology? Number one, there should be lab quality control by logging in specimen details should be properly recorded. The fixation time should be taken note of, since we have seen that either poor fixation can lead to artifacts or prolonged fixation can lead to artifacts. So it's important that the timing should be checked. Then processing also should be checked. Embedding audit, there should be an embedding audit to check during this embedding section if they are done properly, because during that embedding period an artifact can be introduced if it is not done properly. Then there should be daily slide review by senior pathologists for artifact frequency, and which I have observed that in our lab, whereby daily our scientists does the review even before taking it to the pathologist in case of those artifacts identified. Then we can also have checklists where each of those artifacts identified can be written down, and then we now point where they are now introduced, since we have seen that each step in tissue processing can introduce this artifact. So if we have identified the artifact, we can now identify, okay, which particular step was this introduced, so that step now we can go back to that step and check if either the materials used or the technician involved, maybe they will not follow the standard operating procedure. That can now be checked. Then training of technical staff in slide preparation technique can also help to reduce this artifact. The next slide. The upbringing for handling and observe artifact. So when you've identified an artifact, how do we now go about it? The first step, you identify the artifact type, and then you state the particular origin it is from. Either it is from prefixation, whether it is during the processing or sectioning or staining. The next step, you document the slide, then you return to the technical staff with feedback. The third, you repeat the preparation if necessary. If the step can be done again, you repeat it, so that you can now confirm if it is truly an artifact, because there are some artifacts, they can just be so close to a pathological lesion, so you can identify by repeating it. If possible, you repeat it. Then the next one, you maintain record of artifact incidents and then the corrective action that was taken, so that in case that artifact is identified, the technician involved can know what to do. And then there should be continuous auditing and then improvement. The next slide. There are emerging technologies today to help us identify artifacts, and this is also making the process even faster and easier. Digital pathology and AI upgrading can now identify by scanning your slide. So instead of just viewing, or for perhaps maybe new scientists who may not be able to identify all of these artifacts, if we have technology whereby all these artifacts are already stored in the system, then the slide can be scanned, and then the slide will be able to flag off those artifacts in the slide. So that's where we have the automated quality control software in slide scanners. So these softwares are already installed in them. These softwares have inbuilt artifacts already stored in them. So they can now flag off artifacts when they are seen. So for laboratories that are low in resource settings, what can help them is standardizing of their fixatives and then the fixation timing with the processing. Everything should be done in the standard operating procedure. The next slide. In conclusion, artifacts remain a major challenge in histopathology and cytology practice because they can significantly alter tissue morphology, they can also mimic pathological changes, or they can also obscure these diagnostic details. Their occurrence is inevitable to some extent, but their frequency and impact can be drastically reduced through strict adherence to standard operating procedures. Understanding the nature and sources of artifacts, whether from the pre-analytical stage, the analytical stage, or post-analytical stage, enables the pathologists and the laboratory technologists to recognize them early and to prevent misinterpretation. Proper fixation, adequate tissue processing, careful microtomy, clean staining, and correct mounting procedures are essential for obtaining high-quality diagnostic slides. Ultimately, artifacts do not only reflect technical limitations, but also serve as quality indicators of laboratory performance. Hence, awareness, continuous training, and strict quality assurance practices are indispensable for achieving reliable pathological and cytological diagnosis. Also, my recommendations. There should be strict adherence to standard operating procedures, since we have seen that if these things are not done, it can introduce artifacts. Then adequate and prompt fixation is very, very important. There should be regular equipment maintenance, especially in terms of the microtomy, because any change in the clearance angle or maybe blunt knife can introduce artifacts. Then there should be continuous professional training, especially like when new scientists are coming into the laboratory, there should be training, and then even for the ones on ground, the training never ends. It can always continue to refresh one's memory. Then quality control and auditing should be done regularly. There should be proper documentation and feedbacks. Then adoption of modern technology if possible, and then collaboration between the pathologists and the scientists. And this is one thing I admire here in this laboratory, seeing that the scientists are in collaboration with the pathologists. That will help very well in identifying this misinterpretation of diagnosis. So these are my reference, and thank you so much for your time and for listening. Thank you.